Hi, my name is Kathleen Thompson. You can call me Kat. I'm an attorney here at Dixie Law Group. I can't really identify a most common case of medical malpractice. They really run the gamut. What I can say is that what I've noticed is a pattern of the failure to listen to the patient. That can look like a C-section that was delayed too long when signs of distress were not noticed. That can also look like a delayed diagnosis, whether that be a stroke or cancer. The facts are different, but when a patient isn't listened to, sometimes malpractice can occur. The standard of care means what a reasonably prudent healthcare provider in the same specialty would have done under the same circumstances. As an example, if you have 10 doctors in a room and 8 would perform a certain type of test, but 2 wouldn't, then those 2 might not be providing care that meets the standard. One of the biggest misconceptions about medical malpractice is that a bad outcome means there was negligence. That is simply not true. If the violation of the standard of care doesn't cause a specific injury, there's no negligence. These cases require experts in the field of medical care that you're examining. They require oftentimes years to build up the evidence and are very difficult on the patients and their families. That's why we are extremely selective when we evaluate these claims. There are a few situations when a person should at least ask questions. One of them is when there is a bad outcome and no explanation why. Medicine involves risk, but that does not mean that the family or patient should be left asking, why did this happen? Here are some examples of medical malpractice cases people often ask about. The first is misdiagnosis or delayed diagnosis. This usually means symptoms were present, but testing needed to diagnose a condition was not done. A patient may have a skin lesion that needed a biopsy, but the provider did not perform it. This skin lesion later turns out to be cancer. That's an example of a delayed diagnosis where the biopsy might have actually made a difference. Another example are surgical mistakes. These can look like instruments left behind, like a sponge. It can look like the performance of surgery on the wrong limb. These are scary violations of the standard of care, but they do happen. Medication errors can happen in a variety of ways. Wrong dose, wrong drug, failure to investigate allergies, or harmful interactions with another drug the patient is taking. Hospitals have standards and policies in place to prevent just these types of complications. When those safeguards break down and an injury occurs, it's okay to ask questions of lawyers, it's okay to ask questions of your doctor, it's okay to seek a second opinion. What changes medical care is advocacy. Sometimes that's patient-led, sometimes that's attorney-led, but we all improve the system. It can be overwhelming physically, it can be overwhelming emotionally, it can be overwhelming financially after you've been in the medical system for a big event, but there's only 1 year in Kentucky to bring these claims. 1 year can fly by in an instant. Don't wait if you think you may have been harmed by medical negligence. Trust your gut, ask the hard questions, and get an informed expert opinion on whether or not you have a claim. That's what we're here for.